Hello everyone, welcome to lesson 6 of the health and wellness for older adults. Today we're going to be going over acute illnesses and accidents. So remember, before we had this whole segment on chronic, now we're getting into acute. So what are acute illnesses? Well, okay, so acute illnesses are not cute. They're actually very complex. They're more sporadic. Okay, so they're like intense illnesses or intense things that just happen to you, and they're usually more emergencies. Okay, these are like emergency kind of illnesses. Okay, they're very usually short-lived. Usually they can be treatable, but compared to chronic, it's not something that you're going to maintain. It's not something that you know you're going to have forever for a really, really long time. Acute is like, boom, it's happening. We got to treat you, and then you can slowly move into the subacute condition or chronic, or maybe we can just get rid of this. Okay, so that's what acute illnesses generally are. Okay, so older adults are predisposed to getting acute illnesses or acute diseases. And why? It's usually because of their existing chronic illnesses. Okay, it's usually as a result of what they already have going on, or it stems from that. So environmental factors are also going to increase the likelihood or the opportunity for acute illnesses to happen as well, right? So you can get into car accidents, fires can happen, just all these crazy things that normally happen in the environment and that's just for everybody. Okay, not necessarily focused on older adults, but environmental factors increase the opportunity for acute illnesses to happen in anybody. Okay, so diagnoses for infections are actually harder in older adults. Okay, and then the availability of antibiotics and a lot of other medications and things like treatments for acute illnesses are definitely they're more common. Okay, so it's a lot easier, I guess, if you will, to treat more acute illnesses than it would be for chronic, although chronic is long-lived, and that's more of a maintenance thing, because you're probably going to be stuck with it forever. Okay, and then acute illnesses, typically you're not going to be stuck with an acute illness forever. It's going to be very short-lived. Okay, so the downside of antibiotics, okay, because we kind of see antibiotics as like kind of like a cure for a lot of things. Anytime we get any sort of infection or anything like that, we're like, give me antibiotics. Sometimes antibiotics aren't even gonna help whatever we have going on. It's really, but many people will demand antibiotics anyway. I know a lot of physicians out there they just over-prescribe antibiotics. Okay, and for a lot of things, antibiotics don't necessarily. Antibiotics do not help you with your viral infections. Okay. And if you overprescribe people antibiotics, then they may, the bacteria may actually develop resistance against these antibiotics. So if you abuse the use of antibiotics, then things like that can happen. You may have bacteria strains in your body that are going to be resistant to antibiotics, and then these bacteria, they become resilient and they become super bacteria, so you can't really do anything to them. Okay, they become really difficult to work with because the antibiotics aren't going to take with these guys. So patients who do not take antibiotics as prescribed also will or stopping before the prescription runs out and they leave, what happens is if you take antibiotics that you are prescribed for your condition that you really needed antibiotics for, and maybe you start to feel better, so you're just like, oh, I am going to save the rest of these antibiotics in the container for next time I have an infection. Now I don't have to see a doctor. Well, the thing is, you may not have killed all of the bacteria that was causing your infection at that point. So you may leave some resilient bacteria behind in your system. You didn't hit them hard enough with that antibiotics because you decided to stop early. And those bacteria may develop mutations, okay, that will be more resistant to the antibiotics. And then they're going to start multiplying. So you could get sick again. Also, you could, or maybe your body, can handle it this time, but at the same time, you could risk passing that infectious bacteria onto someone else, and that particular strain and that bacteria that you're passing on is, super bacteria. Okay, so it won't be able to take, when those people end up taking antibiotics, it won't really help them. Okay, because you're infecting people with bacteria that is resistant to antibiotics. Okay, so now we're looking at respiratory infections, pneumonia. All right, so pneumonia attacks older adults more than younger people because of their decreased immunity. Okay, so some general symptoms for pneumonia would be having fever, chills, and difficulty breathing. Some symptoms that are more specific to older adults might be weakness, confusion, and lethargy. Okay, so the treatment options for pneumonia would be antibiotics and vaccinations. Then we have influenza. So this is the common flu, right? The common flu, even though most of us get it like once a year or whenever flu season hits, we might get sick, or at least some of us do. I usually, more specifically me, I usually get sick maybe every 2 years or so. That's when I think about every 2, maybe 3-ish years, I'll get a flu and it might hit me kind of hard. Sometimes it doesn't hit me hard enough and then I actually get disappointed. Because the reason is because I usually look forward, like when you're sick, you want to use that excuse to take a break. So if I'm sick, I don't want to be just partially sick and to the point where it's like it doesn't make sense to take a break and I just have to keep going and while I'm still somewhat sick. I don't like being somewhat sick. I like being fully sick, and then I get to just take a day off and you have an excuse, you have a reason to. For me, I've been fortunate enough, I'm generally pretty healthy, so yeah, if I do get fully sick, it's only gonna last a day. But those who the flu can actually be terrible for and deadly, for those who have compromised immune systems, and many people who have compromised immune systems are our older adults. So that is something that we do need to be careful with. We do not want to pass our flu germs onto older adults because when it hits them hard. Okay? I know when my grandmother is sick, it'll last weeks. Okay, it's like she just can't, it takes her a long while to bounce back. So it's actually a lot more serious in older adults. So anyways, so prevention of influenza would be the flu shot, which you can get every single year. I've never got it, but and usually my grandmother, she likes to go, no, I'm not doing any of that. Like I only want natural stuff. But I would say flu shots are, the older adults should have flu shots. because it helps it just helps prevent them from getting sick. Okay, because getting sick for them can possibly be deadly, or if not deadly, they're just going to have a really, really difficult time with it. So anyway, treatments of influenza can be medications, like over-the-counter medications for your symptoms, and then if you have serious complications, it can be treated with antibiotics. Okay, so then we have the common cold. Okay, so older adults are less likely to get a cold because they've been exposed to the cold so many times throughout their whole life. At this point, they've been exposed, you know, to so many different viruses and all of that. So most likely, unless it's a new strain, okay, it's probably not going to affect them much. Okay, and colds are viruses, right? They come from viruses. So yes, they're a viral infection. So anyway, a cold is more likely to lead to huge complications in an older adult if it actually takes. Okay, you could get pneumonia or other serious complications if the cold actually takes, like what is actually happening right now. We have a new virus, the coronavirus, and it's taking, so the older adults are susceptible there, and when it's hitting them, it's causing many other complications. Okay, it's hitting them a lot harder than it is for many other people. So in this situation, antibiotics are really kind of useless. It's not, it has nothing to do with bacteria, so what are you killing? Your antibiotics don't do anything for viruses. So, and viruses aren't even alive. So, it's a much more sticky situation, but one way that you can prevent or you can denature viruses and whatnot, usually through heat, through radiation, depending on the type of virus, many like detergents and other things like bleach and such like that can get rid of them or denature them so that they cannot affect anybody. Washing your hands actually does a lot because they can, the viruses on surfaces, they can bind to the soap and you can wash them away and get them off of you. So anyway, acute bronchitis is our next one. Acute bronchitis usually follows a cold or a flu. Okay, and this is characterized by a productive cough. Productive coughs are those that generate mucus. So they call them productive because you're like you're getting stuff out. Okay, so you're getting your gunk out of you. So it's productive. You're getting some of the bad things out. So treatments of acute bronchitis would be using inhalers, antibiotics, and those who with immunosuppression. If this stemmed from like the flu or something like that, then antibiotics would help. And if this isn't treated, it could progress to pneumonia. Okay, so next we have an ulcer disease. We're looking at acute gastrointestinal infections. So an ulcer disease, ulcers are small holes. Okay, they are holes in the lining of the esophagus or the stomach or the intestines. Your intestines in there. They can bleed or cause pain. Okay, and they can bleed, and that might lead to anemia, which is when you have like a reduced amount of like iron in your blood, so you can't get as much oxygen to your cells. Okay, so it can lead, if you bleed, you're not getting enough oxygen to your cells, so it can lead to anemia. Okay. Ulcer pain occurs usually at night or before meals and may occur with gas or nausea. So some treatment for an ulcer disease would be acid blocking medications. Okay. Also, some remedies might just be drinking more water, eating healthy, staying away from acidic foods, and things like that. So also some ulcers are caused by bacteria and are treated with antibiotics. So if that was the cause of your ulcer, then antibiotics should help. Prevention. So some prevention would be watching out for highly acidic foods. Like I said, soda, coffee are acidic, so is milk, and things like that. Of course, do not smoke, and stress can also have this infection flare up. Then we have gallstone disease. So gallstones are small deposits in the gallbladder, and they may cause like a lot of burping, like wah, and then bloating and nausea and things like that. If a gallstone blocks a duct to or from the gallbladder, then it causes a gallbladder attack, so cholecystitis. Okay, and the incidence of a gallbladder stone increases with age. Okay, so the older you get, the more likely you may have gallbladder stones. So now let's look at appendicitis. This is inflammation in the appendix caused by bacteria. Okay, so usually it affects teens and those who are under 30, but a small portion of these cases will happen after 60, and complications are much higher among older adults. Okay, so complications resulting from appendicitis. So some symptoms of appendicitis would be fear, nausea, pain in the abdominal area, and this is not often found in older adults, which actually makes diagnosing this problem so much more difficult. Okay, so they typically will not have like this, a lot of these symptoms. And so diarrhea. Okay, so diarrhea is quite common. Okay, I'm sure everyone has diarrhea every so often. It's just normal. Sometimes it happens. But it could actually be more serious if it's coming from a chronic illness. Okay, so how do we know if it's coming from a chronic illness? Well, first of all, there are a few steps that we can take. Okay, so we can increase our fluid intake so that we can reduce dehydration, right? Because usually that's what diarrhea will do. It will dehydrate you. So we reduce our dehydration, and then you can use the BRAT method, which is an acronym for eating bananas, rice, apple juice, and toast. Okay, you eat these items, and it should give more potassium into your diet. It's going to give you some more vitamins and a whole lot more fiber, and it's going to also kind of clog you up a little bit. So it'll help solidify a lot of your diarrhea, right? And so if it doesn't clear up within a day or even less than that, then it could be coming from a chronic illness. Okay. Septicemia. This is an infection in the bloodstream that affects the entire body. This is the 10th leading cause of death in older adults and can develop gradually, but will become life-threatening if you don't treat it. So next we have urinary tract infections or UTIs. This is the most common type of bacterial infection in older adults. Okay, the most common type of bacterial infection. The bacteria starts in the urethra, and then it moves up the bladder and to the kidneys. Okay, and the UTI, the urinary tract infection, is often caused by E. coli from your rectum. Okay, so usually this is going to happen when you don't wipe yourself correctly. Remember, you want to go front to back. Or buy yourself a bidet. Okay, clean yourself with water, and then that won't necessarily be a problem. But women are more likely to have UTIs, and then men's UTIs are often associated with an infected prostate. Okay. So pressure ulcers. This is caused by unrelieved pressure and is found mostly in debilitated older adults who cannot shift positions in the bed. Okay, so when you're bedridden and you're just like laying in bed all day long, there's a lot of pressure on your skin and your organs and everything because you're just laying there all day. So if you don't shift positions, then you can get pressure ulcers. Okay, and if they're not treated, they can become infected. Okay, so and they can develop actually after just like a few hours of just like laying there. So that's actually why like even if you go out or like if you get if you're bedridden in the hospital, if you're an inpatient, maybe you just had surgery or something, the nurses will come in like every hour, every 2 hours, and they'll move you to like your side or like your back or your other side, and they'll just keep moving you like all day. And that is so that you do not build up any kind of pressure ulcers like on your back or your side, because if that happens, you can get infected and then you're gonna need care immediately. Okay, and this type of infection is common in hospitals, of course, because there's infection happening like all over the place. So that's why they're extra careful. Let's take preventative measures to make sure you do not get any additional complications while you're in the hospital. But this is a huge problem for older adults, not just because they just had surgery, but just because they might be bedridden. They're laying in their bed all day. Okay, so if their caretaker or whoever is with them doesn't help them move, then they're probably going to develop pressure ulcers. Shingles. This is caused by a reactivation of the chickenpox virus. Okay, so if you've had the chickenpox virus as a child, then it could be reactivated as an older adult. Okay, and then you can get it. There is a vaccine that is approved for shingles. Okay, and then also the treatment for shingles is an antiviral drug that can be given within 3 days of seeing the rash. And I mean, shingles is supposed to be very painful. Not something that you want. I mean, as soon as you think that you may have it, if you have your grandparents or anyone that you think might have it, they might have this type of a rash. Let's get them that antiviral drug as soon as possible. Okay. So then we have hypothermia. This comes from exposure to heat. Okay, when your body temperature is 100 degrees Fahrenheit or more. All right, so Heat stroke is when you have a body temperature of 105 degrees Fahrenheit, and that's caused by insufficient sweating, hot or dry skin, and altered mental status. Okay, so some treatments for hypothermia will be taking an ice bath, and of course you need to contact medical personnel. Heat exhaustion is a bit slower to onset than having a heat stroke and not as life-threatening. Usually this is going to be caused by dehydration and that. Okay, hypothermia. This is when the body temperature is going to drop below 95 degrees Fahrenheit. Okay, so some symptoms of this would be the umbles, and shivering. Some people and then sometimes the person might not actually even feel cold. It may have dropped so low to where they have kind of they're sort of numb to that. So anyway, if this is what's going on, the person needs to you need to try to warm the person up immediately and monitor their breathing. Okay, make sure they're breathing, taking in enough air, and they're just breathing everything out, and everything is working properly. So a major complication, or what this can turn into, could be ventricular fibrillation. Hypothermia can actually happen sometimes after having surgery and all that. It can just be a complication of surgery. So then we have car accidents. So car accidents is the 9th leading cause of death in older adults. Okay, so older adults are more likely to have an accident. Why are they more likely to have an accident? Well, there could be disturbances in their balance. Okay, they might be having seeing problems or hearing problems. They could have a reduced sensation, maybe confusion, disorientation while they're driving their vehicle. Okay, they might have multiple medications, so they could experience side effects that could affect their mental state. They could have an illness while they're driving, so they just may not be well equipped. All this may affect all their senses that is required for them to drive a car safely. Okay, so anyway, let's move forward. So falls are another huge contribution for a lot of accidental deaths. Okay, so falls account for almost a third of these accidental deaths. My great-grandfather actually died because of this a couple years back. What happened was, he fell several times, and then there was just this one time when he fell, and my grandfather was trying to help him, walk him, get him over to the car so that he could bring him to the hospital. And there was one point where he stood him up, so because he could still kind of walk a little bit, right? So he stood him up next to the car while he went to go. I think he was folding his wheelchair or doing something, and then he moved for just a second to go grab something, and then suddenly my great-grandfather falls back and hits his head on the sidewalk. And then so he was bleeding all over here, and then they had to end up calling the paramedics and getting him over to the ER, and he ended up passing away a few days later. So the story is not uncommon. Things like this actually happen quite a bit with older adults. Okay, so This is one of the most common injuries with a fall is bone fracture. So this is probably one of the biggest reasons why we want to stay away from falls. So what can come up from that? Usually hip fractures will happen, which can be the most debilitating, but it's not always just going to be hip fractures. It could be something like you could hit the head and many other spots. Falls can be caused or created by urgent need to urinate. You got to go potty real quick, so you try to get up and get yourself over to the restroom, and then you're trying to make it in time, and moving too fast caused you to fall. Drop attacks, sometimes you just fall. Drowsiness from medications. Many older adults are on a lot of medications that and they find it difficult to kind of be in their senses completely, and so they could get drowsy, they could get dizzy and things like that, and then just fall. There could be a lot of other environmental conditions that could cause them to throw them off their balance and whatnot. Other restraints could be happening, could contribute to that, and then also just poor gait, maybe terrible shoes, or just walking posture and things like that. So more accidents. Motorcycle accidents. Older adults drive the least motorcycles, right, but account for most accidents on a motorcycle on a per mile basis. Okay, so of all the people driving motorcycles or motor vehicles, okay, cars and whatnot, older adults still account for most of those accidents on a per mile basis. So their risk increases of having an accident when they do have vision problems, if they have any kind of chronic illnesses, and if they're taking medications. So anyone who is taking medications has some sort of chronic illness or may have vision problems, they are at risk. Okay, they would be more at risk for getting into a car accident. Anyway, so next we have pedestrian accidents. So majority of these pedestrian accidents will occur at crosswalk intersections. Often they're the ones that have no traffic lights or stop signs. So kind of one of those ones where you sort of have to just get a feel of, okay, well, it looks like no one's here, I guess I can cross, and hopefully people are watching and not just running through. So what happens, older adults are not necessarily walking fast enough, okay, to cross when there is a green walk light. Okay, so, and then curbs can be also difficult for them to navigate, and most of these accidents will happen not necessarily during daylight, but in the evening time. Okay, either when it's dark or it's almost dark. Okay, so choking. Older adults that are 75 and older are more likely to die from suffocation or choking. Okay, so when choking or suffocation happens, those who are much more older are more likely to actually die from this. And most of the victims, when this happens, they're not able to speak and be like, I'm choking. Because they're suffocating, right? And you may see a lot of grabbing at the throat, but usually they'll just suddenly stop eating and pass out. Okay, so if the person can talk or breathe, you shouldn't interfere. But if the person cannot breathe and abdominal thrusts and back slabs and chest thrusts can actually help save their lives. The reason why you don't necessarily want to interfere is because that can actually be it might cause damage, like in their like on their ribs, or something like that, like in their back and all that, because they are a bit more fragile bone-wise and all that. But so if they can still speak, if they can still breathe, let them leave them alone, don't interfere. But if they cannot, then using abdominal thrust, the Heimlich maneuver, things like that can actually help save their life, possibly. Okay, so, but I mean, if you don't know what to do, there's always calling 911. Okay, so other accidents, fires and burns. With older adults, most fires that happen with older adults start from faulty electrical products, okay, or they happen while they're cooking. Okay, most of the deaths occur because of gas or smoke inhalation, not necessarily burns. Okay, most older adults have a much slower response time, and also it's difficult for them to, breathe and whatnot, breathe through all that. So burns due to scalding are more common than burns from fires. Okay. So anyways, that was lesson 6. I hope you enjoyed that and learned a lot. If you have questions, please leave comments or contact me in other ways. And I will see you in the next lesson.